Okay, Michael, why don't you start with this one?
Okay, 41-year-old female, right hip pain for 6 months. Pain 3, painful limited range of motion. Oh, was swelling. Then the impressions, femoral acetabular impingement, right hip plicae syndrome with, I guess the MR showed right hip plicae syndrome with synovitis and ligamentum teres injury. Okay. So the arrows look to be pointing to the superior aspect of the hip capsule, which appears a regular attenuated increased signal. I believe this is probably an arthrogram though.
Dark thing right here.
Okay, and that's what they're talking about for probably what they were mentioning, like a plicae.
So they thought that was a synovial plicae. Here's the surgery.
It's just showing synovial hypertrophy, and that's just going to be a neck plicae right there.
Yeah, that's what the plicae. So the other thing that we don't see very often are these plicaes. Here you can see the probe underneath the plicae here. So they believe that at least MR arthrography is pretty good at detecting these. So that's something to put in your differential diagnosis when you're looking at hips. And they tend to come off, you can see here from the synovium. At least most of the ones that I've seen have been superiorly here. Here's probably one inferiorly. And I think we saw one the other day that was down in through this area. Okay. Ashu, rule out labral tear.
Okay. So looking at this axial sagittal sequences, there is some irregularity of that posterior labrum. Looks kind of thin there. Yeah. It looks kind of smooth though. I'm not quite sure if it's a tear.
So if you remember, when you said before, these right down here, it's pretty close to the insertion of that transverse ligament, but that was of concern. A little bit of thing here, but this is a T1 weighted fat suppressed image because this is an arthrogram. But if we go to the PD fat set images, this is what we see.
Okay, so on the T1 coronal and the PD fat set image, we see a lot of edema of that pubic ramus. Looks like some traction edema maybe.
Remind you that the T1 fat suppressed images, when you're reading in busy time, it may be easy to forget that it's a T1 and not a PD when it's fat suppressed, because we see most of our fat suppressed as PDs, and T1 are really insensitive for these bone edema patterns, so you have to make sure that you look carefully at the PD fat sets, even if it's an arthrogram. You tend to kind of look at the T1 fat sets because they're a little bit sharper at arthrography, but still, in my opinion, the PD fat sets are still more important than the arthrography components, so make sure that you just don't miss these.
Is this hamstring?
Yeah, this is at the origin of the hamstring and traction injury there. Okay, Jennifer.
Okay, so we have some coronal images of the hip, and there is some fluid signal intensity structure along the anterior superior aspect of the acetabulum. It looks like that may communicate through a defect of the chondrolabral junction. So this may be this looks like a labral tear with an adjacent parameniscal cyst.
Yeah. And you can see a little fluid along the iliopsoas here. And this was a labral tear with a paralabral cyst that extended into the Iliopsoas Bursa. Okay, Mike. What, John? What, you say, John?
Would this mean that the labrum is degenerated?
Okay. A degenerative type tear.
Okay. So on the axial image, it looks like we see some hyperintense PD signal and irregularity, maybe along that kind of anterior labrum. So I'm wondering if there's, yeah, right at the contralabral junction. Interior to that is that just the tendon of the ilius. I think it's just a tendon. Well, there's edema through it, so I'm wondering if there's maybe like an Iliopsoas Bursa effusion. And it looks like, yeah, there's edema tracking along that tendon and muscle.
Called the Psoas syndrome, where they get tenosynovitis of the iliopsoas tendon and bursa, and then that means you don't have nice smooth motion of the tendon with respect to the surrounding soft tissues and hard tissues, and then they'll twist their hip or flex it or extend it, and they'll feel that tendon snap because it has increased resistance to motion along the tendon sheath because of the inflammation.
Some people become habitual in doing that. It's like somebody cracking their knuckles, or somebody playing with their thumb and showing that they're double jointed, kind of thing. I don't think you do anything clinically for these that I know of.
So, 17-year-old male with severe pain after a baseball injury. They wanted to rule out a labral tear. The labrum looks pretty good. You see a little bit of edema along the iliopsoas course right there anteriorly, and also on the coronal, see a little bit there. So I'd be worried about it. Coxosaltan snapping syndrome here as well. Again.
Jennifer?
Okay, we have a 76-year-old male with a sports injury 3 weeks ago. Here it looks like there is some intramuscular edema along that right iliopsoas muscle. It's probably a muscle strain. Yes. I don't see a definite tear.
Do you have a good enough MRI here for diagnosis in the axial plane?
No, I would also want to look at the coronal and sagittal images.
Yeah, I would too.
Okay, so here it looks like we're closer to that rectus femoris attachment there. I'm not sure if that's a chronic osseous avulsion injury of the rectus femoris. There's not a ton of edema there. And then there's still that edema throughout the iliopsoas muscle, which may reflect a muscle strain.
And the sagittal.
Okay.
Yeah.
All right, so both rectus and psoas injuries.
So good pickup for both of you. This was an avulsion, a subacute or old avulsion injury of the anterior inferior iliac spine, and the patient also had coxosaltans or snapping hip syndrome due to overuse and tenosynovitis of the iliopsoas muscle tendon. Thank you. Okay, Michael.
Hockey injury. So it looks like there's some signal and irregularity involving the hamstring muscle on the axial. And, since it's an injury, I'm concerned for at least a partial tear. Up there, it just looks to be like some nonspecific soft tissue thickening, and then I guess around the skin there's a soft tissue edema. This is just a contusion then? Okay, so then what am I seeing? The hamstring is just slice selection?
suggested like
That was just a contusion. Right? But it was usually these hockey players, you know, they can have a fractured bone and they don't complain about anything. And this guy came in with complaining about this little contusion. And it was also
Are we talking like something like a blister? Or
I don't think it was a blister. I think it was just a much broader base than that. And some of it might have been just friction from the clothing that they wore too. So
yeah, would expect blood if there was any
yeah.
contusion type of thing.
Well, I mean, you see a lot of inhomogeneous signal intensity, so this could be some subcutaneous hemorrhage in through here.
Yeah, that's what I was thinking on that particular sequence.
Okay, well, I'm going to cut out here, and then why don't everybody get back on in a minute, and we'll go and start talking about the wrist.